Welcome all of you. I am Sonali Tayade, Assistant Professor of Zoology. Today I am going to explain about the amniocentesis. Amniocentesis, as the name suggests that amino means amniotic, related with the amniotic fluid, and centesis means to puncture. So in this test, some of the fluid from the amniotic sac is taken out for the further examination of the health status of child. So amniocentesis, it is a prenatal test. Okay, prenatal test means this test is performed when the fetus is present inside the womb of mother. This test is usually performed in the second trimester of pregnancy between the 15th and 18th week of pregnancy. It can be performed as early as 12 weeks or as late as 20 weeks. Then how this test is performed? In this test, a long thin hollow needle is inserted through the abdominal wall of mother into the sac of the amniotic fluid. And this complete test is under the guidance of ultrasound. Once the needle is inserted, small amount of amniotic fluid is withdrawn from the amniotic sac, which is nearly about 2 tablespoons. Now, this withdrawal fluid is sent to the laboratory for the further examination. This fluid contains the cells from the baby, certain chemicals, and the microorganism present in the fluid. And all these cells of the baby, chemicals, and the microorganism help to understand the health status of the fetus. Now, in this diagram, you can see that this is the uterus of the pregnant women. Then here is a fetus, here is a placenta, and this is the umbilical cord. This umbilical cord is connected with the placenta. Surrounding to the fetus, there is an amniotic sac, and in this amniotic sac, the amniotic fluid is present. Some amount of amniotic fluid is extracted with the help of the needle, and this process is under the examination of the ultrasound. This ultrasound scan will help to understand the exact position of the child so that the needle will not poke the child. Now the extracted fluid is sent to the laboratory for the further study. Now the total process of inserting the needle and withdrawing of the amniotic takes place only 5 minutes, but the guiding the needle to the right position using the ultrasound scan, it takes 20 minutes. Once the needle is out, there may develop some tummy cramps. After the procedure is done, doctor will monitor mother to check whether having any uterine contraction, and also checks the heartbeats of the fetus to make sure he has not become distressed by this procedure. This test will help to identify several hundreds of genetic disorders such as Down syndrome, that is 21st chromosome trisomy, Edward syndrome, that is 18 chromosome trisomy, certain neural tube defects such as spina bifida and anencephaly. Along with the chromosomal abnormality, it also helps to determine the maturity of lung of fetus. Now, when this test is offered to the women, when there is a significant risk for genetic diseases, if there is a problem during the ultrasound examination, if the ultrasound examination is abnormal, if the family have a history of certain birth defects, certain genetic disorder, and if the previous child of that women, pregnant women, has a birth defect, and if the age of the mother is 35 or more than 35, so in that cases the physician will ask the women for the amniocentesis process. Now let's understand what are the risks related with the amniocentesis. The first is amniocentesis process. It is safe, but it is an invasive procedure because in this procedure physician insert the needle inside the amniotic sac to remove certain amniotic fluid. Now second is about 1 in 200 women may develop the infection or some other complication after the amniocentesis. Some women may leak amniotic fluid or small amount of blood from the vagina. In some rare cases, the needle may touch the baby, and due to the poking of the needle to the baby, it may lead certain complications. Indications of the infections include high temperature, uterine contraction or tenderness, feeling chilly and hot. So this is all about the amniocentesis process. Thank you for watching.